Over the years, I've consistently seen patients in my office with a similar constellation of symptoms. It's typically a woman or a man complaining of one or more of the following symptoms: fatigue, irritability, easy weight gain, depressed mood, anxiety, panic attacks, problems with memory, dry skin and hair, cold intolerance, fluid retention, PMS, constipation, thinning hair, poor fingernails, elevated cholesterol, frequent infections, headaches, pain in the lower back, carpal tunnel syndrome, fibromyalgia, or some other chronic pain. Now, in medical school, I learned that many of these symptoms that I just listed were in the medical textbooks as being associated with low thyroid function. But, and this is a big but, 9 times out of 10, when I've checked thyroid hormones on these patients, the levels like the TSH, free T3, free T4, and thyroid antibodies are all in the normal range. Many of these patients have a history of seeing their doctors, and they've been having prescribed all kinds of drugs to treat symptoms like antidepressants, stimulants, pain medications, cholesterol-lowering drugs, and frequent antibiotics. They might even be prescribed a weight loss pill that requires the use of a diaper. So I asked myself, why are these symptoms so common, but the lab tests tell us the thyroid is normal? Now, in medicine, where there's not an industry or a profit center for therapy, it can quickly die out. Years ago, I was listening to an audio CD of a medical conference where Dr. Jonathan Wright was speaking, and he talked about a way of making the diagnosis of low thyroid using a simple test of metabolism. Now, I had to learn to admire the way Dr. Wright doesn't throw out treatments just because they're old. In my medical training, I remember if there wasn't a double-blind, placebo-controlled trial of the therapy published within the last 5 years, my professor said, "Hey, must be no good." And that was drilled into me as a student. But Dr. Wright mentioned a simple method of measuring body temperature as a way to determine low thyroid function. A low temperature in the contents of hypothyroid symptoms would be enough to consider a trial of hormone therapy. Dr. Wright then mentioned a book, Hypothyroidism, the Unsuspected Illness. It was written by Dr. Broda Barnes in 1976. I went out and got the book right away. In the book, Dr. Barnes used basal temperature as a method for screening thyroid dysfunction in his practice. And through his own research, he determined what a normal temperature was supposed to be. Now, he found through treating thousands of patients that the method was very reliable in identifying hypothyroid sufferers, and they consistently improved when he treated them with thyroid hormone. He based the diagnosis totally on body temperature. If the temperature of a patient was below normal and had symptoms, then he or she was a candidate for a trial of thyroid hormone therapy. Now, Barnes believed that low thyroid function was the reason for the epidemic of heart disease in his day. He even wrote a book titled Solved, The Riddle of Heart Attacks, and that was based on this premise. Even today, science backs up that underfunctioning thyroid is a major risk factor for coronary disease, but our doctors only want to give us cholesterol-lowering pills. Dr. Barnes also speculated that thyroid disease was rapidly increasing because of antibiotics. He thought they were saving the hypothyroid children that before antibiotics were culled from the herd through death from infectious diseases. I don't know if that's true. Another explanation for the increase in thyroid problems is a possible lack of iodine in the diet and iodine depleting substances in our food, water, and other products. Iodine is not only beneficial for the thyroid, but increases the excretion of toxic metals like mercury and lead. It's important to also realize that taking thyroid hormone will increase the need for iodine in the body. So why are we so often at risk for low iodine? Well, first, iodized salt is a poor source for iodines. Studies suggest that only 10% of iodine in iodized salt is bioavailable. In addition, poor farming methods don't replenish iodine in the soil. Now, you probably have heard we have a goiter belt in the middle of the country around the Great Lakes where iodine is very low in the soil. Diets without fish and sea vegetables also tend to be low in iodine. People on a low salt diet are at risk. High consumption of bakery products reduces iodine. Vegan vegetarians are also at risk for low iodine. Bromide is used as an anti-caking compound in baked goods and depletes iodine. In the past, iodine was used as an anti-caking agent, but it was replaced by bromide in the 1980s because of concern that excessive iodine might be a problem for the population. Other sources of exposure to bromide includes its use as a fire retardant and a fumigant for crops. Fluoride may have a similar effect and is often added to water, and of course it's added to toothpaste. Iodine is concentrated in the thyroid, breasts, prostate, adrenal glands, salivary glands, cerebral spinal fluid, and the ovaries. Diseases associated with iodine deficiency include thyroid disease, chronic fatigue, fibromyalgia, depressed immune function, mental retardation, goiter, infertility, increased infant mortality, as well as breast and prostate cancer. Now, none of those disorders sound like fun. Iodine has been shown to induce apoptosis, which is cell death of cancer cells. Iodine can function as both an oxidant and an antioxidant in the cell. Oxidation is an important mechanism of how our body disposes of unruly cells like precancerous cells. Iodine deficiency is widespread. NHANES, which is the National Health and Nutrition Survey, data shows that iodine levels have dropped 50% in our population between 1971 and 2000. Now, during the same time period, we've had an increase in thyroid illnesses, various cancers, including breast, prostate, endometrium, and ovarian. There are ongoing studies trying to determine if identifying and correcting iodine levels can help or treat breast cancer. Now, ways to keep your bromide exposure down include eating organic food, limiting the intake of bakery products, and possibly taking supplemental iodine. You also want to get adequate natural salt and optimal magnesium. Now, in my experience, both as a clinician and personally, I have found that both iodine deficiency and thyroid disorders to be extremely common. Now, my professors in medical school, those that talked about the double-blind, placebo-controlled studies, well, they also told us, treat the patient, not the lab results. We were not supposed to blindly treat lab results without looking at the patient first. My patients have told me countless times that they have been told by their doctor that their thyroid was normal based on a blood test, and either they should suffer through their symptoms, or even more likely, the doctor might say something like, hey, let's try some Prozac, maybe you're just depressed. If my patient has a constellation of symptoms that look like low thyroid, but the lab tests are normal, I will consider using Dr. Barnes' approach. Doesn't that make sense? It does when an excellent physician like Dr. Barnes has worked out, through his practice of medicine, the confirmation of his hypothesis based on the diagnosis and treatment of this disorder. But it didn't catch on. Maybe it was too simple. Maybe it's because there's not a profit center or no deep pocket organization to support bigger studies. But for my patients, it's worth a trial of thyroid hormone. If your symptoms are improved, what more proof do you need? But for some people, the prospect of being on a thyroid hormone for the rest of their life doesn't sound so good either. And I have found many times when you put people on the hormones, it helps them at first, but then the symptoms may slowly return. So in my search for thyroid solutions for my patients, I came across Dr. Wilson's work on a disorder he's termed Wilson's temperature syndrome, which actually builds on the work of Dr. Barnes. Now, Dr. Wilson began looking into the constellation of hypothyroid symptoms and temperature. His theory is that the problem with low thyroid function comes about because of a stressful event in a patient's life. Anyone out there had one of those? Probably not, but I'll continue on with this story anyway. So what happens is a survival mechanism kicks in during severe stress to lower metabolism. This is to conserve energy in order to avoid starvation. The body makes less T3, this is the most potent thyroid hormone, and makes more reverse T3, which is inactive and blocks the thyroid hormone receptor. Conventional doctors typically treat low thyroid with synthetic T4, Synthroid or Lavoxyl are the brand names, which is in this situation will be converted to more reverse T3, and in the case of Wilson's temperature syndrome, make a patient's symptoms worse. The solution then is to give T3 in a dose that normalizes the temperature and allows reverse T3 to normalize, really resetting the thyroid symptoms. After temperature is recaptured, a patient then weans off of T3 medication, and there is restoration of normal thyroid function without the need of being on any medicines or hormones. Now, this doesn't always work, but it should be considered before permanent thyroid hormone therapy if the clinical picture fits Wilson's temperature syndrome. Now, this is something you can easily test yourself. Normal oral temperature is 98.6 degrees Fahrenheit. Now, Dr. Wilson advises checking your temperature 3 times daily. It's done 3 hours after you get up, 3 hours later, then again 3 hours later. If your average temperature over a period of a couple of weeks is significantly below the normal, say below 98.2 degrees, and if you have symptoms related to low thyroid, you may benefit from a trial of Wilson's T3 protocol to rebalance thyroid function. Iodine, along with other nutrients that are important for thyroid function, can be supplemented as well, and they can be tried as an alternative or even in addition to T3 therapy. Now, this needs to be under the guidance of a physician. Now remember, the symptoms of low thyroid can include weight gain, cholesterol elevation, depression, fatigue, dry skin, constipation, edema, thinning hair, irregular menses, carpal tunnel syndrome, fibromyalgia, coronary artery disease, migraine headaches, frequent infections, and many more symptoms. Now, thyroid treatment is not a cure-all for every symptom. Do not overlook the possibility of iodine deficiency because it's always better to look for the cause than it is to treat the symptoms. Thyroid malfunction is a common problem, and it may be an underlying cause for numerous seemingly unrelated symptoms that you may have. You won't be well served by taking prescription drugs in an attempt to suppress the symptoms. The websites brodabarnes.org or wilsonsyndrome.com have more information on this topic. I really hope this information has been helpful for you. Hit the subscribe button above to get all of our latest natural foods diet videos. This is Dr. Gerhauser. Thanks so much for watching.